Okay, good afternoon. Today we're going to talk about the piles or hemorrhoids. There are different names for these. They normally well known by most people is called piles, and it's quite a common problem and it's quite annoying as well. And we use these words in lots of movies to say we're using a different language in the local language about the discomfort that people face from the pulse. So they could vary from very, very minute symptoms like just a discomfort or uneasiness where you want to just make it comfortable by that, or to an extent it can be extremely painful to the point it can be bleeding. So before we put, what are the causes of bleeding from the back passage or rectal bleeding? There are quite a few causes. Depending on the age, we categorize what type of the symptoms that cause the bleeding. So don't ignore if you have the bleeding and think it's all piles, because cancers of the bowel, large bowel, can present with the bleeding just like piles. And I have come across a lot of patients. For example, I had a lady who is from some Eastern Europe, I guess. She's 28 and she said she had bleeding, and then when I had to do the procedure, I was thinking it will be piles, but when I went there I found a large tumor. So it's very difficult sometimes to predict the causes for the bleeding, and people miss the opportunity to diagnose early cancers because a lot of these patients present with the bleeding from the back end. And if they are early, especially the polyps, which are early cancers, we can remove them. So don't ignore if you have bleeding thinking it's all piles, and it's extremely important that you get investigated. So what are the other causes of bleeding from the back passage? It could be diverticular, where there's pockets. If you got a bowel like this and they got pockets there, they can bleed. Or you can have inflammation in the bowel called inflammatory bowel disease that can cause bleeding as well. And the various other features that can cause this type of bleeding could include ulcers in the rectum, solitary rectal ulcers that can cause the bleeding as well. And very old people who had treatment for prostate cancers, they get radiotherapy, and this causes the new blood vessels to form in the rectum, and that can cause bleeding as well. So these are the various common causes of rectal bleeding. And for that, what do you do to find out the cause for the bleeding? So the simple investigation is called flexible sigmoidoscopy. So it's a limited examination of the back passage by putting a black tube and have a look inside to see what's happening. That's called flexible sigmoidoscopy, and that can differentiate a lot of these features. Sometimes people do need colonoscopy depending on the indication. So how do you diagnose piles? So we diagnose the piles just by symptoms. Number 2 is investigation, which includes endoscopic investigations, where we put a tube down your back passage, which we talked about, either colonoscopy or flexible sigmoidoscopy, and then we find a grape-like blood vessels popping inside. So what type of piles can cause bleeding? They vary from quite a lot of things. When the bleeding happens, it's quite frustrating for the patient and for the family as well. I get a lot of phone calls. I even had phone calls from, recently from USA, because the mother was visiting her daughter in the USA, and she had the bleeding, and she expects me to cure the piles from far off, which you normally give some general advice for the early piles, which includes the cause, what are the causes that exaggerating the piles bleeding. So going back into the what are the causes of these piles bleeding. So constipation, when you're constipated, you have hard stools, and when you're trying to pass the stools, it's very hard, so you have to really strain. So when you're straining, you're pushing the floor of the rectum with great pressure, and then that causes the blood vessels to pop out and then cause the little bit of a strain on those veins and cause the bleeding. So constipation is extremely important. Pregnant women does suffer with piles formation as well. People who have some sort of intra-abdominal pressures that can cause that. People who had liver disease, they also develop hemorrhoids because of the back pressures going back into that. And idiopathic, we don't know why some patients have piles compared to other people. And then, how can you manage that? You manage them based on what's triggering these things and how severe these piles are. People also come to me saying they could feel some lumps at the bottom end, or some people will say they could feel a painful lump, which is a thrombosed hemorrhoids, which can be quite painful for those patients. Some people miscommunicate thinking it's a fissure because it's so painful and they can't pass the stools through the painful thrombosed hemorrhoids. They also feel like this. And then, going back, what are the grades of these piles? There are 4 grades. Grade 1, grade 2, grade 3, grade 4. So grade 4 is the blood vessels at the bottom end, they pop out and they don't go back inside and they hang outside. That's the grade 4 hemorrhoids. And these are the patients who are able to feel that. And grade 3, they pop out but they can be going back inside. So these group of patients, if they have severe bleeding, so you need a different strategy of managing these patients. And if you want to know more about this, you're more than happy to take a consultation with me at KIMS Hospital with Dr. Chandra. So, and there are early piles, which are just the little blood vessels or the popping out things. And for these type of group of patients, I give them laxatives or stool softeners, which makes the stools to pass easily so that they don't strain much, so that they don't actually aggravate the pressures on those veins, and also give some special creams to make it numb and also reduce the swelling. Okay, so for grade 1, grade 2, you could just try the medical management. For grade 3 and grade 4, and it's been a significant bleeding, then we could look at options. There are lots of options. You don't need to have surgery to treat the piles. For example, you can have injection therapy. It's a day case procedure where we actually just inject into the piles to shrink them, or you can put the bands on them, so like a rubber band, and then they increase the tamponade mechanism and block those blood vessels, or even latest techniques like laser. And there is another one called X-roid, which is a special low energy electrocauterization of these vessels. It's called X-roid technique. So, and staple technique, where you can able to pull these things up and then staple the vessels up. So, and obviously the gold standard is the hemorrhoidectomy for the larger things, but most people don't prefer those surgical options unless they have failed the conservative management or the other non-aggressive managements, depending on the symptoms, of course. So these are the various options that has the effect on helping the hemorrhoidal bleedings. So if you have any more questions or any consultation required around the bleeding from the back passage, please do contact me, Dr. Chandra at KIMS Hospital.